Hello everyone, my name is Noah Slimp, and today I'm going to be giving you a brief pharmacology lesson on the medication amiodarone, also known by its brand name Cordarone. So what is amiodarone? Amiodarone is classified as a class 3 antiarrhythmic. Being an antiarrhythmic means that it can treat a malfunctioning heart rate or rhythm that may be going too fast or too slow. It is also a potassium channel blocker based on what it does in the body. Amiodarone is used to treat patients in cardiac arrest that is being caused by life-threatening ventricular arrhythmias such as ventricular fibrillation and ventricular tachyarrhythmias. It may also be used in the management of atrial fibrillation and recurrent supraventricular tachyarrhythmias. However, this practice is not used near as much anymore due to the possibility of potential adverse effects. Amiodarone works to decrease heart rate and to return the heart back to a normal sinus rhythm by blocking the transportation of potassium through potassium channels in the cardiac myocytes. This action in turn causes a prolonged cardiac action potential and refractory period in the heart, which results in decreased electrical activity, allowing the heart to reset and return back to a normal heart rhythm. When amiodarone is given intravenously, it has an immediate onset of action and hits peak levels within 20 minutes, and the duration will last as long as the IV is set. When given orally, the onset of action may not be until 2 to 3 days, but with peak levels reaching at 3 to 7 hours and the duration lasting 6 to 8 hours. High concentrations of amiodarone mainly build up in the liver, fat, lungs, and skin, and it is largely metabolized by the liver. It has a half-life of 10 days and is mainly excreted through the bile. Amiodarone may cause several adverse effects. These effects include dizziness, malaise, fatigue, ataxia, nausea, vomiting, anorexia, and constipation. Some of the worst adverse effects include hypotension, bradycardia, heart failure, and the worsening of pre-existing cardiac arrhythmias. There is a black box warning for amiodarone that states a risk for pulmonary toxicity. It is for this reason why amiodarone is reserved specifically for life-threatening dysrhythmias if they can help it. Contraindications include dysfunctional sinus node, cardiogenic shock, heart blockage, severe bradycardia, hypokalemia, lactation, iodine allergy, and is used cautiously in pregnant patients and with those with thyroid dysfunction. The administration and dosage of amiodarone may depend on the type of arrhythmia that is occurring. For example, for VTAC and VFib, you would give 300 mg rapid bolus followed up by 250 mg bolus if not resolved. As for all other acute tachyarrhythmias, you would infuse 150 mg over 10 minutes and slowly reduce it then. For children, administration of amiodarone is mainly based on their weight. For adults, you would never exceed 2.4 grams in 24 hours, and for children, 20 milligrams per kilogram. It is important to teach the patient about the use of amiodarone. Teach the patient to look for symptoms of pulmonary toxicity, which include difficulty breathing, chest pain, and a bad cough, and to report them to the provider immediately. Also tell the patient that they will be on a cardiac monitor at all times so that the healthcare team will be able to continuously monitor their heart status. Also teach them how to take their own blood pressure and pulse rate, as this may help them assess the medication effectiveness on their own. Long-term oral therapy of amiodarone may interact with many drugs such as beta-adrenergic blockers, oral anticoagulants, digoxin, and phenytoin. They may all increase the effects of amiodarone and worsen arrhythmias. St. John's wort may actually decrease amiodarone levels and should be avoided. Do not take with grapefruit juice as well, as this may also take down the effects of amiodarone. They will also always need to come in for chest x-rays and pulmonary functioning tests every 3 to 6 months to assess their health status. Although amiodarone is a potassium channel blocker, it still has the potential to exert its blocking effects on the other ion channels in the heart, which causes the severe adverse effects that may lead to fatal outcomes. Researchers believe that if we could understand these pathophysiological mechanisms of the ion channels better, that it would help us better treat arrhythmias while also lessening the severe adverse effects of amiodarone in treatment. If we could somehow learn to manipulate the environment that connects the ion channels in the heart and be able to more specifically target the potassium ion channels, that we would be able to completely eliminate the adverse fatal effects of amiodarone and make it one of the most effective medications in the treatment of arrhythmia. I hope you all enjoyed my video today, and I hope you were able to learn a little something about amiodarone from this. Thank you all for watching, and I certainly enjoy your time. Goodbye.